各位傳媒朋友，大家
Members of the media, good afternoon. Thank you for coming to the media's briefing. The Chief Executive will say a few words and then she'll take questions from the floor because we're in an epidemic, so please try to keep your distance. Now I'll invite the Chief Executive to speak. Friends of the media, members of the public, now immediately after the 4:30 press briefing by the Center for Health Protection, I'm here to meet with the press again. Because I would like to talk about our policies and our strategies in response to the epidemic. I'd like to give you an account at the first instance. Just now you heard the report from the Center for Health Protection, in particular the analysis of Dr. Choi. And so you know that we are still in severe stage of the epidemic, and there's been major outbreaks in the community, and that's why we've seen an exponential growth in the number of cases, or rather we could actually see an exponential growth in the number of cases in the community. It could happen any time. And 2 days ago, on the basis of this assessment, with the three experts I appointed, and then also Professor Lau Yulong and Professor Kong, I was in discussion with them, and every day I also talk to the Center for Health Protection to find out about their latest assessment, which is based on science. So our assessment is based on a number of factors that I'm going to come to now. I understand some of them were mentioned at the press briefing just now. First, in terms of the number of confirmed cases, it remains at a high level. It's over 100 cases. And as the media reported today, today we have 164 confirmed cases. That's record high for a single day since the epidemic started 2 years ago. But of course, compared to the peak on the 30th of July 2020, at the time there were 149 cases in a day. Now, on the 30th of July 2020, among the 149 cases, 145 were local cases, only a few were imported cases. But today, for the 164 cases reported, 48 cases are imported cases, local cases count for just 116 cases. Of course, it's still a record high. Now, and not the second factor is that we have this assessment is because of Omicron, because for most of the infected cases, they involve the Omicron variant strain. Omicron has taken over from Delta as the mainstream variant strain around the world now, and Omicron is highly transmissible. And you can tell from the number of infected cases that Omicron is highly transmissible. As Dr. Choi pointed out, for people living under the same roof, that is family members, it's very easy for them to get infected if there's some confirmed patient there. The third factor has to do with Delta being brought into Hong Kong by imported hamsters, and there are still more infections. For example, the Choi Wan estate cluster, there are over 20 cases, and many of them are actually Delta cases, because we could all trace these cases to hamsters as the source of infection. And then there are more than 30 untraceable cases so far. If each untraceable case is a silent transmission chain, that means we have over 30 silent transmission chains in a community. So people could be infected. The fifth factor is Hong Kong is one of the few cities that makes use of sewage surveillance for us to identify positive cases or in a particular block. Now, for the 4:30 press briefing just now, I asked the Director of Environmental Protection, Deputy Director of Environmental Protection, to come and give you an account of the sewage surveillance. Now, we would actually do sewage surveillance either at fixed location or at various locations, and we have identified many positive samples. You can see actually every night we will switch on either the red or the blue dots at different locations. Red dots means there are contaminated samples are found. So, and there are many red dots. So you know there are many transmission chains in the community. So what sort of strategy should we adopt in the face of all that? Now, the first local Omicron case was found on the 30th of December, and we've been following the same strategy since in taking forward our work. That is, we are trying our very best to break the transmission chain as soon as possible so that we can achieve dynamic zero infection. We're not saying that cannot be infection cases in Hong Kong, but we should have the ability to suppress the spread of the disease. Now, on the 30th of December, you might recall, it was the air crew member that started the Omicron outbreak. There was the Moon Palace case, and there was also a dance group case. Well, for these cases, or rather these two transmission chains, we were successful in breaking the transmission. For example, for the Moon Palace cluster, the cluster came about on the 14th of January, or rather after 2 weeks, we no longer see new cases related to that cluster. As for the dance group, well, there are many more cases. So the last case linked to the dance group cluster was found on the 22nd of January. Since then, there have been no cases linked to this cluster. So that shows that we do have the ability to stop the spread of the disease in Hong Kong. But then for these two other chains, it's rather challenging in terms of identifying the source, because it's, say, for the Kwai Chung estate case, it seems that there's a super spreader who went about in different blocks in the estate, and because Omicron is highly transmissible, that's why we have seen a major outbreak in Kwai Chung estate. The other chain was started by imported hamsters, because we do not know how many people are still keeping hamsters. And we're very much grateful to pet owners who gave up their 100 plus hamsters, although reluctantly, of course. And then for the Wong Tai Sin cluster, it was started by imported hamsters and then eventually spread to Cheung Po House in Choi Wan Estate 1. Now, so we still do not fully get a picture for these two chains, because here we're talking about both the Delta variant strain and the Omicron variant strain. So that's why we are certainly not, sitting our hands in the face of this. And we have been adopting swift and stringent measures in the hope of breaking the transmission chains as soon as possible. And what have we done? For example, in Kwai Chung Estate, we resorted to a measure that we already took before. Now there are 3 blocks subject to 5-day or 7-day restrictions testing declaration. And we've also stepped up tracing of cases. Many are concerned about the manpower we have at the contact tracing office. In fact, in this short period of time, we have doubled the number of staff there. Many actually are from disciplined services. They have great experience in investigation of cases, and they are now helping with tracing close contacts. And then the third measure we've taken is the testing that we've been doing all along. For example, every night in a particular block or in a particular area that's been enclosed, we are doing testing. And then we have to wait till the test has been completed and negative results are seen before we allow people to leave the block. And then in the past 3 weeks, we have done at least 60 restriction testing exercises. and sometimes a few exercises in one night. And then we've also resorted to compulsory testing notices. That is, we don't try to keep people at home, but we require them to take compulsory testing repeatedly. And so far, some 960 locations have been subjected to compulsory testing notices. And then for environmental consideration, as the Deputy Director of Environmental Protection told you, that the scope involved may be extensive because sewage does flow around, so it's hard to just confine it to a block. So that's why in these cases we have encouraged voluntary testing. Those who want to be tested will definitely get tested. And so we have mounted large-scale testing operations. So in the past 3 weeks or so, we have done over 2.5 million tests so far. And we're talking about a huge number of tests. That's why in the past week, we have been trying to boost the capacity of testing contractors. In the past week or so, on average, we are doing about 130,000 tests a day. The usual capacity is about 100,000 tests a day, but then we have been, going into overdrive. So in the past week or so, on average, every day we are doing 130,000 tests. So it shows, but then we can see that all these measures are effective. We are, of course, facing a serious challenge. But I hope the public will have confidence in us that the actions we're taking are effective. In fact, for more than 60% of the locally infected cases, when they are found to have been infected with positive test results, they are already in quarantine centers. Not like they are they've been going about in the community. So that's because we have early identification or early isolation. So if someone become infected and they're isolated earlier, that means we could prevent the creation of more transmission chains. Now, and of course, we're doing more in testing sewage so that we could achieve early identification. In other words, we're racing against the spread of Omicron. Now, we know that Omicron may have hit a particular block, and sewage samples may test positive, but then there are not yet infected cases. But at least the sewage is giving us a warning, so we know there's infection in a particular area or block. Now, we have some 100 fixed locations for testing of sewage today. In the past week, in terms of the frequency of sample collection or in terms of quantity of samples collected, we have seen a rise in the past week or so, and we will continue to do more. And there's one case you're familiar with, and this case has been identified because of the sewage surveillance, that is Tropicana Gardens in Wong Tai Sin. It's because we found positive samples in the sewage there, and then we conducted compulsory testing, and that helped us identify cases, and that's a Delta strain case. So that's why in face of the rapid development, I am going to announce some new measures. First of all, for Kwai Chung Estate, there are 3 blocks now under 5-day or 7-day restriction testing declarations. In the next 3 days, the declaration period will come to an end. For Yat Kwai House is tomorrow morning, the 28th of January, Yin Kwai Lau, the 29th of January, Ha Kwai House, the 30th of January, and of course, the 29th of January. But of course, for Yat Kwai House, there was an extension from 5 days to 7 days, and Ha Kwai House has always been subjected to a 5-day declaration. But for Yat Kwai House, the peak was on the 22nd of January. 76 cases were identified on that day, but now it's dropped to a single-digit number. So having assessed the risk, we decide that tomorrow morning we will end the RTD for Yat Kwai House. In other words, tomorrow morning, after residents have, completed certain formalities or collected some materials and so on, they could leave. But they will still have to take repeated compulsory tests to play safe. But we don't want it to make it inconvenient for them. So for some of the repeated tests that could be done by the deep throat saliva approach. So tomorrow we'll be distributing collection bottles to the residents there, and then they could then take the compulsory test on the specified days. And before we end the restriction testing at common places in Yat Kwai House, that is the ground floor common place, and the common place on each floor, the housing department will carry out thorough sterilization so that residents could rest assured when they are allowed to leave their units. And then on the distribution of supplies or sample collection bottles, the Home Affairs Department is responsible for that. Now, after we've dealt with Yat Kwai House, then for Ying Kwai House, I must say, unless all of a sudden there's another outbreak. Well, it shouldn't happen, but it's hard to say because Omicron, is such difficult the virus to tackle. But anyway, unless there are unforeseen circumstances, the approach for Ying Kwai House will be the same as that for Yat Kwai House. But of course, it will be a day later than Yat Kwai House that the RTD ends for Ying Kwai House after 7 days. But Ying Kwai House residents also will have to take a number of repeated tests. As for Ha Kwai House, we do not see the need to extend the RTD period from 5 days. For the 5-day period, it ends on the 29th of January, because for 2 days in a row, we have not identified new infectious cases. So again, unless there are unforeseen circumstances, Ha Kwai House, same as Ying Kwai House, will see the end of the RTD on the 29th of January. But I would like to make an appeal here, because there are many blocks in Kwai Chung Estate that have seen a major outbreak of cases. It's believed that it's because there are cleaners moving about in the different blocks. So I would like to make a number of appeals. Firstly, for Kwai Chung Estate residents, we hope that they will try to stay at home in the next 8 or 10 days or so, as far as possible. Please avoid going out. And then they must also take the compulsory tests as required by the Center for Health Protection. Now, even for residents not living in Yat Kwai House, Ying Kwai House, or Ha Kwai House, they are still subject to CTN. They have to take repeated compulsory tests, and if they feel unwell, they must seek medical help at once. They must also pay attention to the personal and environmental hygiene. For some period at Kwai Chung Estate, there will still be a large number of residents who have to take compulsory tests. So the mobile testing stations will stay there. The hotline will also continue to operate to serve residents of the estate.
Once again, I'd like to thank the 30,000 or so people in Kwai Chung Estate. They've been subject to a certain inconvenience, and if they experience any particular difficulties, they're welcome to express their views to us. We've designated a hotline to address questions relating to a labor issue. Because of this RTD, we will try our very best to offer assistance. Their contributions go a long way to curbing a potential massive outbreak in Hong Kong. So we will be maintaining the hygienic condition of the housing, social distancing. Earlier, I have already stated that in a big way because of the seriousness likely to have government to fine-tune or to the 17th of February. We will suspend all the large-scale events and group gathering events. And I'd like to urge the corporations and organizations not to hold these large-scale events, because we really need to keep down the number of people gathering. Also, all the in-person classes will have to be suspended for another fortnight till the 21st of February. And there are more school holidays than public holidays, so they will be remain suspended till 21st of February. The other measure is to guard against importation of infection cases. There are 8 countries, because of the outbreak, the raging COVID in these countries, that they have put on the list of circuit breaker system. We'll be extending another fortnight till the 18th of February. Earlier, we've assessed the transmissibility of Omicron variant, but the incubation period is shorter, and there are we have reduced the quarantine period from 21 days to 14 in Penny's Bay, and this, on top of this, we have 7-day self-monitoring. And starting from the 5th of February, travelers to Hong Kong who have to be quarantined in hotels for 21 days, we will be shortening this to 14 days, plus another 7 days of self-monitoring. People can go out within these 7 days, but there are 2 days on which compulsory testing will have to be undertaken. All these measures that I mentioned will come with further details, and the relevant bureaus and departments will be briefing the media on the specific details. You may ask, what are we supposed to do during this period other than the anti-pandemic initiatives? We have to ramp up the vaccine coverage, and this is a way out of the pandemic. We have to have the roadmap and the timetable, and all these should be predicated on high vaccine coverage. Starting from the 24th of February, we will be extending on a large scale the vaccine bubble. The vaccine bubble may give rise to different interpretations. Now, this is, in fact, a vaccine pass. All the details will be announced shortly, but in general, there are several areas. The CE in Council will amend 599F. That's regarding the regulation on the premises. We will be expanding the list of premises to cover more premises for which people will need to have the vaccine pass. Now, this 599 pass covers the food establishments, and a dozen or so premises. Will be expanding the scope. For this to happen, we have already launched the updated version of Leave Home Safe app. I've already downloaded myself. This will have the record of vaccination, and for those who have the dispensation, they also have these recorded, so people can have this device available. Now, that's about the vaccine pass for the premises. You may ask, what sort of premises are we talking about? The policy bureaus are looking into this. We're basically talking about the indoor premises, and we have to be more determined in order to incentivize people who have not got vaccinated to go get the jab. Now, the elderly population is subject to pretty high risk. In our anti-pandemic efforts. We have to safeguard people's lives. We have to make sure that the hospital facilities will not be swamped. If elderly people get infected, they will suffer more serious consequences. For those who are unvaccinated, they will suffer even more serious consequences. And elderly people who are unvaccinated might be hospitalized for a long time, and it is doubtful whether one will be able to recover from it. So we have to ramp up the vaccination there. For those 80,000 elderly people who are living in the elderly homes, through doctor's certification, if the elderly people are fit for vaccination, if they agree, then we will administer vaccination on them. And the medical staff will be conducting the assessment for the elderly people to get vaccinated. The effectiveness has been pretty good. We will be expanding this practice, and we hope that for the residents in the elderly homes, and we will be able to ramp up the vaccine coverage. From a certain day, people who want to be admitted to these homes, they have to be vaccinated. If they are unvaccinated, they will be hard put to it to find any homes that will accept them. So this would provide justification for people to get the jab. Towards the end of February, we're going to be implementing the vaccine pass system, and the vaccination coverage is pretty good on a daily basis. We have 40,000 or so doses per day. As of last night, 78.6% of people have already got the first jab. If we can cover 80,000, then we can increase this by 3% or 0.3%. We hope that with the passage of time, we will be able to bring it up to a reasonable level. Now we are trying to achieve 90% for people who get the first jab, and this is a roadmap. We are moving towards this 90% target. And with this basis, we will be able to consider adjusting all the rest of the measures. Another area of work is to further extend the social distancing measures and close the premises. Certainly this would impact various people. Now we've announced the AEF 5.0. There are 20 programs, and they're accepting applications, and the funding has already been dispersed for some of them, and we'd like to make it swift. And our design is that we use the remainder of the AEF. We don't have very much in the way of remainder. And in the sixth round of AEF, we need to go to the Finance Committee for funding to be injected into the AEF. I cannot tell you for the time being how much we're going to be injected into the fund, but we certainly will be adopting a compassionate attitude towards these premises, and the adversely affected. We will be listening to the views of these premises and the electrical members. A lot of views have come through, have been forthcoming from the electrical members, and the policy bureaus will be sorting out these views in preparation for the new round of the AEF. And after the Lunar New Year break, when LegCo comes back, we will be consulting the Council and seek funding from the Finance Committee.
In a few days, it will be the Chinese New Year. Of course, I know that Lunar New Year is a time when family members gather or visit each other. But then this year we have a serious epidemic, so I have to appeal to you to stay home and try to avoid family gatherings, because we want to avoid the spread of the Omicron variant strain. well, we need to work together to fight the disease, and I'm confident that together we'll be able to prevail over this new wave of outbreak. Of course, we need to do much cleaning work. We find that for cleaners and security guards, they come into touch with people a lot because of the nature of their work. So we will be talking to the relevant trade associations and groups so that they will do more tests for their staff members during this period. This is to protect their own themselves as well as the community. And then the SL government will be fully mobilized during the Chinese New Year. We're not taking any break. So we'll be working all the time to fight the epidemic, and there will be no distinction among departments. They will all form teams to fight the epidemic. And for retired civil service colleagues, please come back and help us. We are now doing recruitment. So because we want to boost our capacity in a number of ways. One, in terms of testing capacity, we have approached many contractors. They tell us that if we give them a day or a week or two, they'll be able to go beyond the capacity of 100,000 tests per day. Second aspect is the collection of sewage samples and testing of samples. The capacity will also be substantially increased after the Chinese New Year. And then we will be increasing our quarantine facilities in case more people need to be sent to quarantine. So apart from Penny's Bay, Lei Yun Mun, and some designated hotels, where there are in total there are some hotels with 4,000 units, we have also approached 2 additional hotels to be used as quarantine hotels. And then by the end of this month, we should be able to administer 60,000 doses of vaccine today. Now we're administering 40,000 doses a day, but we have the capacity to do more. And so if there are incentives to encourage more people to come forward and to get vaccinated, then we'll find ways to boost our capacity. But then the first thing is we want to make sure that elderly persons who want to get the jab will get it the day they walk into the center. So we need to reserve places for them. And if unfortunately people have to be isolated and treated because they've been infected, then as was mentioned just now in the press briefing, there will be additional isolation and treatment facilities at the Asia World Expo. So we are making preparation for the possibility of even more outbreaks. So that's all by way of my opening remarks. Now the floor is open to questions. Those who would like to ask questions, please raise your hands. And when you're asked to ask a question, please first identify your organization and then use the microphone to speak. The gentleman in a tie at the front. I'm from TVB. This morning, the Election Affairs Committee has already announced the nomination period for the chief executive. So when are you going to announce whether you are going to run for a re-election? Second question. Now you say you're going to boost the testing capacity. A number of electoral members, and in fact many in the community, have suggested universal testing and that you should seek assistance from the central authority. So what is your view on that? Do you plan to seek help from the central authorities? Well, on your first question, I do note that the chairman of the Electoral Affairs Commission has announced the nomination period and the eligibility criteria for the election. But I am working hard to fight the virus now, so I have no time to think about anything else. On universal testing, just now, as you heard, I announced the number of tests we have to do every day, and it's a huge number. And when we're doing this number of tests, it could lead to inconvenience or even anxiety. If we are to test all 7 million people in Hong Kong in a short period of time, you can imagine whether it is possible or not. Now, the last time we had something only close to universal testing was the universal community testing that we did in September 2020. In 2 weeks, 1.7 million people took the test, and then we had to make preparation before. We had to set up these extra laboratories, and then some 500 laboratory professionals were sent from various parts of the mainland to come to Hong Kong to help us with the test. So what we're doing now is to try to boost our testing capacity and adopt the measures that I mentioned, so we could devote our effort to find infected cases as we try to cut the transmission chain. That's probably more effective use of resources. And how can we keep enriching the resources we have? As I said, we have already approached a few testing contractors. Now, if they could get support from the mainland, it would help them to boost their testing capacity. I've already made a request with the Guangdong provincial government, and immediately they asked what we needed, and then they gave us a contact so we could approach certain contractors. Now, do we need equipment or test kits or personnel and so on? They could help. But of course, it would be difficult to actually conduct a universal testing exercise. Next question, the lady at the back.
The South China Morning Post. Health Minister Sophia Chan said this morning that she thinks we have the virus under control, but we have more than 30 untraceable cases, and you just announced the extension of social distancing measures and the suspension of face-to-face classes being extended. So do we have the virus under control or not? Second question is, given the strain in resources, complaints about chaotic arrangements, and even more cases being uncovered in different housing blocks, what kind of help will Hong Kong be asking the mainland for? And thirdly, I understand the incubation period of Omicron is shorter, but are authorities shortening the 21-day hotel quarantine also because of the risk of cross-infections at those facilities, which led to the massive outbreak at Kwai Chung Estate? Thank you.
Of the three questions, first is I have not watched Professor Sophia Chan's interview, because every time people ask me about a comment made by one of my principal officials, I have to be very careful, because sometimes you have to look at the context, under what context that particular comment or description was used. But if you ask me, based on what I have just elaborated, it's certainly not a situation that would give us the comfort or the assurance that it's under control. We are expecting that any time it could have an exponential increase in cases, and it could give rise to a massive community outbreak. Because as you have rightly pointed out, up till now we still have more than 30 unlinked cases, and if each unlinked case represents a silent transmission chain, then it is very risky. And on top of that, our sewage surveillance also does not give us that level of comfort, because we are still seeing positive signals from some of the stationary points and the mobile points that we have put into in terms of the sewage sampling. But I would suggest you do not put the blame on the Secretary for Food and Health. She is under extreme pressure and workload, and so that comment, if that had been a comment of under control, I think she wants to convey this level of confidence in the government and also in society to combat this latest wave of COVID-19. Now, about the arrangements, I did confess on previous occasions that for an operation like this, whether in the Kwai Chung Estate, that we actually are restricting residents for 5 days or 7 days and supplying 3 meals a day, and clearing up the municipal waste. There's a large amount of municipal waste, and arranging a daily test and answering hotline. I'm confessing that we are not doing the best, but we are improving. We want to improve and to make life easier for residents of the Kwai Chung Estate, especially the 3 blocks under restricted testing declaration, to have less anxiety. But as I said, in an operation of this scale and of this complexity, I wouldn't want to sort of comment that my colleagues are deliberately not doing a good job. They have tried. If you have gone down to look at what they are doing, they have tried their very best. We have pulled in colleagues from various departments. So while this housing department is the commander, the Home Affairs department is the major supplier of all these necessities, more than 10 departments are at any point in time in Kwai Tsong Estate providing support and services to the residents there. In terms of help from the mainland, experience tells us that because of a different system, different practices, in fighting COVID-19, the assistance that we have received from the mainland so far fall into these areas. One is supplying technicians to us so that we could strengthen or increase the testing capacity in the laboratories. So we still have to train our own swabbers, but they are working in the laboratories. There are over 500 of them on the previous occasion. Another assistance is to supply furniture and equipment. For example, when we first equipped Asia World Expo into a community curative center, all the beds came from Shenzhen because suddenly we have a large demand of all these hospital beds, so the stock came from Shenzhen. The third is, of course, to build for us this ICC, this Infection Control Center under North Lantau Hospital, now has over 800 isolation beds. So these are the areas which experience tells us could be more easily arranged. Whereas if you say that, what about sending us some medical staff? What about sending us some staff to visit the Kwai Tsong Estate and to do the testing on the spot and meet with residents to provide counseling? That is perhaps far more difficult because of the different systems and the language and so on. So at the moment, I have already requested Guangdong government to help us again on the testing capacity in the laboratories. Based on what I have been told by a couple of testing contractors who have their bigger operation in Guangdong. So they asked if we could talk to the Guangdong government and arrange for them to bring some of their capacity in Guangdong or in Shenzhen to Hong Kong to help. That is something that we have asked the mainland to help. Now, the shortening of the hotel quarantine period from 21 days to 14 days plus 7 days self-monitoring is purely based on science, because Omicron's incubation period is relatively short. So we have, based on this science, already shortened the quarantine period for close contacts of confirmed cases at Penny's Bay Quarantine Center and other quarantine center from 21 days to 14 days about a week ago. Okay, so there's no logic or no consistency if we still impose the 21 days on arrivals. They are not even close contact. They are arrivals from a country which may have more transmissions and so on. So this is only to ensure consistency based on pure science. Thank you.
下一條提問。
Next question, gentleman at the back. Commercial radio. A moment ago, you mentioned 2 quarantine hotels. How many units are there? Also, vaccine pass. The Leave Home Safe app will show the vaccination records and also a dispensation for vaccination. Are you going to make the Leave Home Safe app on a real name basis? Also, there are suggestions that you're going to be replacing Mr. Casper Choi, Secretary for Home Affairs. Can you confirm this particular news? 3 questions there. First of all, we'd like to get in touch with more hotels to become quarantine hotels. The number is not high. First, not many hotels are willing to do so, and not all are suitable for this purpose. And there are some that accept booking for the arrivals. And it is not an easy decision for them to be turned into a quarantine hotel. The FHB told me that they are liaising with a number of hotels, but not on a large scale. The hotels with 1,000 or so rooms. Right now, anything that can be done to increase quarantine facilities will be a good thing. Second, Leave Home Safe app and the vaccine pass. If you download the app, you can experience the convenience there. And this is to tie in with what we're going to do next month, and that is the vaccine bubble, whereby people will not be able to get into the premises unless they have the vaccination record or dispensation. But this has got nothing to do with the Leave Home Safe app on a real name basis. Now, if we want to go down this route, you have to do something about the handset. That we keep the record in the handset itself. Mr. Alfred Sitt made some points in Let's Go. We do have the vaccination record, and this will enable the Leave Home Safe app to carry more personal information. If in an unlikely event that infection takes place in the premises and contact tracing will have to be done, then with the vaccination record, the premises will be able to provide the information on the patron's vaccination record. And this would help with the contact tracing. We were not turning the Leave Home Safe app into a real name kind of app, because that would be more complicated. Third, any speculative reports will not be commented on at all. Next question, please. Gentleman in beige, please. HK01. You mentioned the vaccine pass, and you're going to be expanding the scope of premises. Now, vaccination is on a voluntary basis. Now, how is it different from a vaccine mandate for you to implement this measure? Are you going to take the vaccine coverage to 90% before you would not tighten the social distancing measures? Now, you kept talking about zero COVID measure. Now we're talking about dynamic zero COVID policy. Now, how do you mean by dynamic zero COVID policy? How many cases do we have to have before we can call this dynamic zero COVID? How many cases do we have before we can reopen the border? Now, you said you would not comment on any speculative reports. How far along is the investigation in terms of progress? How soon are we going to have the result? Now, to bring in the vaccine pass doesn't mean we are mandating people to get inoculated, but without vaccination, people will get less in the way of a choice. And there is a difference there. If people have a choice, you have to bear with the consequences. The consequences follow the choice. Now, if you choose not for medical reason, given the COVID situation, not to get vaccinated in the interest of public good, you will have to bear the consequences that you will be denied entry to certain places. This is different from mandating people to go get inoculated. So we are resorting to these measures to incentivize people to get the jab. I talked about 90% today. Strategically, if we want to make any difference, this is the basis we must have. The good basis is to enhance the vaccine coverage. In our country, in Singapore, they managed to achieve 90%. So we need to ramp up the coverage as a target. I don't want people to come away with the concept that we need an 80% from now to 24th of February if we administer 2,000 doses, first dose. The target is in sight, and if we can achieve 90%, then we can certainly make a difference to the situation. Dynamic COVID, zero COVID policy, this is a mainland strategy. We have already explained our strategy. We're not trying to close Hong Kong to the rest of the world. We're not trying to make the number zero, but we are trying to curb the emerging wave. Now, some experts are saying that this is somewhat like what is being done in the mainland. If cases arise, then they will try to keep on top of the emerging wave. And this is called dynamic zero COVID, but this is not started by us. If you want to have a more authoritative interpretation in terms of the word dynamic, I'm afraid I cannot give you the definition. But people really are anxious to have the border reopened. So we're now meeting with the mainland. We're trying to let the mainland know that we are adopting a similar practice. If they accept that this is also a dynamic zero COVID policy, then it is a dynamic zero COVID policy. On Tuesday, I've already made the point that prior to the Lunar New Year, I will be giving an account. The last day before the Lunar New Year is Monday, and this remains my target. I'm going to give an account. Let's make it the last question. Lady in white, please.
There are 3 questions from RTHK. The first one is, can you give us a clearer picture on how widespread this vaccine pass initiative will be? Will unjabbed people have enough time to get vaccinated before it's out in place? And second question is, how will the government address the concerns by family members of elderly people who live in residential homes? Is there any worry that people may accuse the government of forcing elderly people into getting jabs? Third question is, do you think that reducing quarantine period to 14 days will adequately address business concerns about the negative effects for 3-week quarantine that has had on business activity? Thank you.
Thank you for the 3 questions. Now, first of all, the vaccine pass is to help encourage more people to be vaccinated. Because the effect of a vaccine pass is if you have not been vaccinated, you will not be able to enter a lot of premises or engage in a lot of activities. At the moment, the CAP 599F covered about 15 categories of premises, like restaurants and gyms and beauty parlors and so on. So we are planning to amend CAP 599F to expand the ambit so that more indoor premises will be included in the scheduled premises for us to impose this requirement. And beyond the statutory schedule, we can also do it for the government premises. So entry into the TAMA office, into LCSD libraries, will from a day onwards be subject to vaccine pass. You raise a very valid question, is whether we will allow enough time for those who get vaccinated so that they could make themselves eligible for entering the premises. The answer is yes. That's why we have to calculate the days very clearly. I mentioned in early January, the date of 24th of February is to provide 6 weeks in advance for people to get the jab. So in future, we will make sure that when we announce something new, then there will be sufficient lead time for those who have not been vaccinated to get vaccinated. Just for argument's sake, we will probably, in time to come, expand this vaccine pass requirement from 1 dose to 2 doses and to 3 doses. So every time we will allow sufficient time for those who have not taken the second dose or the third dose to be able to take, at least they have a chance. If the duration is too short, they don't even have a time, then that's not fair. So every time we will make sure that they have enough time to get vaccinated. Now, for the elderly homes, we all agree, I hope we can all agree, that elderly people are particularly vulnerable. The reason why vaccination makes good sense, especially with Omicron, is because Omicron is highly transmissible. But a lot of literature and experience elsewhere in Hong Kong prove that somebody who is vaccinated, even if he or she gets infected, the illness will be very mild. That's why up till now, with over 600 confirmed cases in HA hospitals, none are serious or critical. Every one of the 600 plus is stable. That's because a lot of them have been vaccinated. So I would really make a very strong urge and appeal that elderly people or their family members should encourage and accompany and bring their elderly parents and grandparents to get vaccinated. Now, at the moment, in the residential care homes, the vaccination rate is no good. Even with our new scheme called Assess and Vaccinate, that is, we send in medical teams, the VMOs, the visiting medical officers, to do the assessment and then vaccinate if the elderly agrees. The total rate is still 30%. So 70% of the 80,000 of residents in the elderly homes and homes for the disabled have not been vaccinated. So if a couple of these are infected, the consequences are very serious. So we will be expanding this, what we call the Assess and Vaccinate scheme, to all the residential homes in time to come. And under it, it means that if the elderly is able to make up his mind, he still has a clear mind to say yes or no, then we will ask the elderly, after a medical officer has seen him or her, and tell the elderly lady that you are fit to take the vaccine, no worry. And if she nods her head, she wants to vaccine, then we will vaccine. We don't need to go back to the family members to ask them for permission and so on. But if the elderly person does not have a clear mind, for example, they are senile, then the family member or the guardian will be given an option whether he or she will want this elderly person to be vaccinated. So that's how it works. And I have said that the way that we operate is Assess and Vaccinate has produced very good results. For example, in the week just ended on the 23rd of January, we have vaccinated 880 elderlies in homes, whereas half a year ago, for another 7-day week, we managed to do only 240. So a 3 to 4 times increase in the rate of vaccination by going for this Assess and Vaccinate scheme, and which means that we will need to provide more resources because we need to pay the visiting medical doctors to do all the individual assessment and then the vaccination. But resource is not an issue now. The most important thing is to keep Hong Kong safe. Now, about the final question about the quarantine period. I have received firsthand, I have read a lot of reports about the business community's strong reactions to the very, very stringent rules imposed by Hong Kong on arrivals. But on this occasion, the sort of revision from 21 days hotel quarantine to 14 days hotel quarantine plus 7 days self-monitoring is not because of pressure from anybody. It's just because of science. The science of Omicron tells us that Omicron has a relatively short incubation period. I think the median duration of an Omicron infection is only 4 to 5 days. So 14 days quarantine will be good enough, according to my experts. And we have already introduced this 21 reduced to 14-day in the Penny's Bay Quarantine Center and other government quarantine facilities about a week or 10 days ago, because of the science. So it will look very illogical and inconsistent for us to continue to put arrivals on 21-day hotel quarantine. So this is really a matter of consistency in application based entirely on science. But whether this will satisfy the business community, definitely not, because they want 7 days or no day of quarantine, which are some countries in Europe fully opening their borders. But that is for Hong Kong, that's a very dangerous move, because I said many times, we do not possess the prerequisites for living with the virus, because the vaccination rate is not good, especially amongst the elderly. I could not stand seeing a lot of old people dying in my hospitals. So we will try our very best to raise the vaccination rate. If it reaches a target of 90%, then that is the moment for us to consider some adaptation to our existing policies. 多謝各位。
Thank you very much. That's it for today. Thank you all very much.